All right, we'll go ahead and get started. Thank you all for joining us this evening for APSE's Wednesday webinar series, The Missing Middle, which will focus on aging and lifelong disabilities in early and middle adulthood. This is the third session in our series. My name's Ashley Giles. I'm the advocate for the aging in Henrico County, and I've been a member of APSE, the Area Planning and Services Committee on Aging with Lifelong Disabilities, for nearly 10 years. APSE is a coalition committed to bridging the gap between disability and aging networks, ensuring that adults with lifelong disabilities can age with dignity, independence, and access to effective supports. We work to identify service needs and gaps, raise public awareness about the needs of those aging with lifelong disabilities, and offer cross-training for professionals. And we plan for emerging issues in aging with lifelong disabilities. If you'd like to learn more about APSE, please drop your email address in the chat, and we'll be sure to send you more information about our committee and about upcoming events. A couple of housekeeping items. We do ask that you save your questions until the end of our session, or you can feel free to drop them in the chat and we will work with our speakers to answer them at the end of the session. This evening, we will explore the topic of housing. We recognize that affordable and accessible housing is really difficult to find, and we're excited to learn more about resources regarding housing at this meeting tonight. The first speaker we have tonight is Kelly Hickok, and she is the Community Service Manager for Resources for Independent Living, a private nonprofit, non-residential organization serving individuals with disabilities in Richmond, surrounding counties, in the Tri-Cities. Kelly has a degree in architectural drafting and design and construction management, which allowed her to work with design and building professionals, directing numerous projects related to architectural accessibility, universal design, and the Americans with Disabilities Act for almost 40 years. Since joining Resources for Independent Living in 2004, Kelly has served on numerous boards and commissions of the Commonwealth to advise, advocate, and impact systems change in all aspects of community living for individuals with disabilities. Kelly served 8 years on the Virginia Board for People with Disabilities and also served on the Community Integration Advisory Council, or Commission, to provide input to the governor on issues impacting the lives of individuals with disabilities. Kelly is an active member of the National ADA Leadership Network after completing an in-depth Train the Trainer course offered at fewer than 100, there are fewer than 100 ADA consultants nationwide, Kelly, thank you so much for being with us today, and we're excited to learn about the resources for independent living.
Well, thank you so much. It is an honor and a pleasure to be with you this evening to share some important information about individuals with disabilities and specifically some issues around housing advocacy and increasing the housing capacity for individuals with disabilities in our communities. As the slide, let's see, can folks see this? There we go. So as the slide said, it really is more about more than just getting through the door. There's so many different avenues that have to be explored when you're trying to find housing that's appropriate to an individual's needs. Before I get into that, though, I do want to talk a little bit about Centers for Independent Living, and we can move to the next slide. So I am with, as Ashley said, I am with Resources for Independent Living, which is the Center for Independent Living here in the Richmond area. And we serve planning districts 15 and 19. And there are 17 centers for independent living across the Commonwealth. And even with that, there are areas of the Commonwealth that are underserved and unserved. And we continue to advocate for those areas to be able to have centers for independent living so that we can reach those individuals in needs in those communities. But beyond the 4 core services that all CILs provide, and they are advocacy, independent living skills training, peer mentoring, information and referral, and transition services. And that's transition for youth transitioning out of high school, as well as seniors or individuals who are living in communities, in institutional settings where they don't choose to be and want to transition back home to their communities. And so that those are the two categories of transition services that we work with in those individuals. But beyond that, each Center for Independent Living is really just working to meet the regional needs of the individuals that are coming to our door. And those needs are very diverse. And so we just try to meet people where they are and help them get to where they would like to be in their independent living. Next slide. Let's see. So we are a private, nonprofit, non-residential, cross-disability, community-based organizations. And our goal is to assist individuals with disabilities to live independently in the community, and also to, as I said, to assist individuals with disabilities to transition to the community from institutional settings. Two things that we unfortunately are not able to do is to offer financial assistance to individuals with disabilities, as well as we don't duplicate services. So if an individual is receiving services, say receiving housing services from another entity, we would not duplicate those services. But there may be other ways that we can assist the individual and help them. And we certainly want to be able to do that. Okay, next slide. So that's fine right there. Much of our country, of course, as we know, is in a housing crisis. However, when you add the unique needs of individuals with disabilities combined with the economic realities that those individuals face, the challenges of finding affordable and appropriate housing becomes so much greater. Many individuals who've aged out of youth services and don't yet qualify for aging services do find themselves in that missing middle. And aging with a disability also requires that we think about and prepare for changing needs and abilities as we age. And we can certainly help in that capacity as well. Next slide. Okay. So what do we see as major barriers for people with disabilities? Well, obviously, affordability is a huge issue. Accessibility. That term accessibility is relative to people's understanding of accessibility, because sometimes people think, well, an apartment unit is accessible if it doesn't have steps to get into the front door. Well, there's much more to accessibility than that. Discrimination sometimes is an issue. Sometimes we make opinions about people and we decide things about people, and that can sometimes lead to discrimination. Lack of an adequate subsidy. We all know that there are housing choice vouchers out there. There are options, but there are waiting lists, there are qualifications, there are all sorts of things that make those subsidies sometimes not available, and don't meet the needs of individuals with disabilities. And of course, transportation plays into the picture as well, because when there's a lack of transportation, if that individual finds the most perfect housing situation for their needs, and they are transportation dependent, then if they move into that situation, they're not able to access their community. They're not able to move about their community, to go to the grocery store, to go to the drugstore, to go to church, to go to community activities, those kinds of things. So in that instance, that home can quickly become a person's institution if they're not able to access their community. Okay. So there truly are barriers at every step. common issues for individuals with disabilities in obtaining housing. CILs address many of these issues in the process of working with individuals to find appropriate housing. And we've identified a lot of different barriers that we continue to try to eliminate. I could provide you with a lot of statistics and data on these issues. However, I think it's more important to talk about people and some of the things that we have seen and we know that individuals with disabilities face. Studies have shown that oftentimes landlords who advertise units for rent often refuse to speak to deaf individuals. Both deaf and individuals and wheelchair users often don't receive the same level of encouragement as non-disabled persons in when housing testing is conducted. Many landlords refuse to request a reasonable modification or accommodation, and often landlords don't understand their legal obligation to permit a reasonable modification. Some indicated that they would not do it if they were asked to do it. Next slide. So there are also some misconceptions, and we all know that the attitudes, opinions, and assumptions that are made about people that we perceive to be different can absolutely be huge barriers and can also lead to discrimination, whether intentional or unintentional. Some of those misconceptions are that there aren't many individuals with disabilities living in the U.S. And the fact of the matter is, one in four Americans is reported to have a disability. Approximately 70 million people living in the U.S. That people can't afford to live there anyway. Working age individuals with disabilities have discretionary income to spend, or that it will cost too much to provide a modification or an accommodation. But it's important to think about what it's going to cost not to provide that accommodation, especially when it's easily accomplished without a lot of difficulty. I want to just share a couple of personal stories with you. I love to share personal stories because I feel like in that you can really see that, see what kinds of things happen to individuals. And we can argue with facts and figures all day long, but when someone tells you what's real in their world and what they've experienced, that really paints a picture. So my husband and I, after we got married, we were starting to look at apartments, and we just hopped in our lift equipped van. And I forgot to tell you, I'm a wheelchair user, but I am. And so we hopped in our van and we went hunting for apartments. And we pulled up to this one apartment, and we were bringing the lift down, getting ready to get out of the van. And the apartment manager comes out of the office door and says, "I doubt if you want to take the time to get out of your van. I'm sure you can't afford to live here." So that was quite shocking for us and kind of left us with the opinion that, with someone thinking that, that's probably not the place for us. So we got back in our van and went to the next place. Another opportunity that we had to look at an apartment, we really liked it. If there was availability, and the manager was working with us on the paperwork, and we got to the financial part, and she said, "Well, you don't work, do you?" And my husband said, "Yes, yes." And she looked at me and she said, "Well, you don't work, do you?" And I said, "Yes." And she said, "Well, do you just have a little part-time job or something?" And I said, "No, my husband and I both work full-time." And turned out that they had an income limit, and we didn't qualify because we made too much money. So again, going through starting the paperwork and assuming that we didn't work and we didn't have income. So those are just a few of the things that, attitudes, opinions, and assumptions that lead to discrimination or just lead to leaving a person with a disability feeling like they're not going to be accommodated or it's not desired for them to live in these communities. Okay, next slide. So, why is this still happening? We have talked about these things for years and years and years, and we still, unfortunately, are dealing with some of these issues. Um, is it meanness? Is it cruelty? Is that people don't want to be bothered? They don't understand the law? Is it fear, anxiety, and prejudice? Or is it just a lack of awareness and understanding of the needs of individuals with disabilities? I, for one, would like to hope that it is the last one, that it is a lack of awareness and understanding. And through opportunities like this, we hope that, we can lessen that. And it's still happening because we have work to do. We have work to do to bring understanding and awareness and to educate and advocate for expanding housing options for individuals with disabilities. Centers for Independent Living are at the table looking for new approaches and keeping the vision of options, opportunities, and choice in housing. Many individuals with disabilities don't understand their rights, or that it is illegal for landlords to refuse to make reasonable accommodations for individuals with disabilities or permit reasonable modification to housing units. So we spend a lot of our time assisting individuals with disabilities and helping them understand their rights and learn how to advocate for their rights in many areas, but especially in housing. Some affordability challenges. Many individuals with disabilities are living on extremely low incomes, and it can be challenging to afford even a one-bedroom apartment or an efficiency. Often, because of the lack of availability, a person may not even be able to make changes to accommodate their specific needs. Then there are the fees that are associated with some of the housing options, such as the ability to pay a fee to hold an apartment. The first and last month rent is sometimes very hard for individuals with disabilities to come up with. And there are other rents and requirements that communities have that can make it very challenging. And oftentimes we'll get calls from individuals and say, I found a place that is perfect for me, but I can't afford the down payment. I can't afford to hold the fee to hold the apartment or the unit. And can you help me with that? Okay. Next slide. So the thing is, we can all become advocates. Effective advocacy involves organizing and building inclusive futures for all people. And so you're an important part of that process. You don't need to have a disability to learn how to advocate for people with disabilities when you become aware of the needs. Why is it important to advocate? Because it's our job, because it's the right thing to do to make the world a little more tolerant and accepting. We're all different and we all have different disabilities, but one thing for sure, we all need a place to live. So, what are Centers for Independent Living doing about all of this? Well, first of all, the majority of what we do centers around educating and advocating. Educating individuals with disabilities about their rights and how to advocate for their rights, how to be a good tenant, how to work with landlords, and also educating housing providers on some of the needs that individuals with disabilities have. Sometimes we're able to work with apartment managers when there's a misunderstanding about what a tenant with a disability is asking for versus what the housing provider feels like they can or should provide. So we're able to work with those entities to help them understand why these things are needed. And most of the time it works out pretty well. Um, we work closely with the Fair Housing Office and Housing Opportunities Made Equal and other community partners to provide training and information on housing needs of individuals with disabilities. Assisting housing providers with improving access within their properties. Oftentimes we'll get calls from property owners and they'll say, someone is requesting that we put a curb cut or an accessible parking space or that we widen the doorway. So we'll work with them to try to figure out the best option, maybe suggest a contractor that's experienced in doing this kind of work, and just try to be as helpful as we possibly can for the individual to get what they need to accommodate their disability as well as for the apartment community to understand the needs and to be able to provide those needs. Working with families and individuals to help them adapt their homes to accommodate changing abilities. Many of us hope to be able to age in place, hope to be able to stay in our homes for as long as possible. Or we're building the home that we hope to age in place in. So we work with individuals to help them figure out what are some things I can do in the building process. But what are some things I can do to think about long-term needs so that my home is ready for me to accommodate me and my changing abilities and needs. And then also providing information and referrals to housing resources based on individual needs. We spend a great deal of time just providing information and referral about housing resources and helping people look for appropriate housing. We don't place people. We get calls every once in a while. I need to place my mom in a facility, and we're all about helping that person stay in the community and have the supports and services that they need. So we are not a placement agency. And then advocating. We spend a great deal of our time advocating with and for individuals with disabilities and helping them understand and receive equal access in their housing. We work with legislators before, during, and after the General Assembly, especially when legislation is introduced that has to do with housing affordability and accommodating individuals with disabilities in housing. We work with planners, builders, contractors, and architects to provide input on designing disability-specific requirements such as universal design, accessible design, disability-specific design, all of those things. And that's actually the reason I knew at a young age that being born with my disability and being a wheelchair user, I knew that I wanted to get to the people who were putting pencil to paper to say that, hey, people like me need options and opportunities in housing. And so I always wanted to be able to design commercial and residential spaces for individuals with disabilities. And fortunately, been blessed to spend most of my career doing exactly that. And still, in a lot of ways, working for the Center for Independent Living, have the opportunity to use that expertise to help individuals with their housing situations. And that's all I have to share with you today, and I'll be happy to entertain some questions when we're ready.
Thank you so much, Kelly.
Sure.
Our next speaker is Deanna Parker. Deanna Parker is the director of the Office of Community Network Supports at the Virginia Department of Behavioral Health and Developmental Services. In her position, she has oversight over the developmental disability community supports and services, including the Individual and Family Supports Program, IFSP, employment, supported decision-making, and HCBS policy, HCBS settings regulation implementation. Deanna received her BA and MPA degrees from Howard University and Old Dominion University, respectively. She received her post-baccalaureate certificate in disability leadership from VA Lend in 2019. Deanna has over 25 years combined direct advocacy and policy making experience in both the public and nonprofit sectors. Deanna has been active in the special education and disability community since 2000 as a parent, advocate, volunteer, and mentor. Deanna is married and the mother of 2 adult children, 1 daughter, and a son with autism. Thank you so much, Deanna.
Deanna, we'll need you to unmute.
Somehow I knew I was going to do that when I muted myself. But anyway, I appreciate the introduction. And the only thing that I would add, because I think it helps with understanding this program and what we do, is that my office really helps people who do not have funded services. And those who do, we kind of help bridge the gap to make sure that they can use their services a little bit better. So I'm going to go to the next slide. All right. So we are talking about shared living, the waiver service. So back in 2014, during the start of the waiver redesign, the state had an idea really to recreate in Virginia a service model that we had heard about in Pennsylvania called life sharing. And really the premise was that someone who had a developmental disability would live with and share a life with another person in a true roommate relationship, just like you and I would have. And then that would be incentivized by a Medicaid payment. We did research the Pennsylvania model, but unfortunately, we realized that the model was actually closer to a service that we currently have called sponsored residential placement. And that is where an individual with a disability moves into the home of a person, a couple, or a family, and they provide or arrange for care or supports for the individual. But this wasn't the exact vision that we had for this service. So we worked with DMAS and CMS for a full year during the waiver redesign to build out the structure and the rules around the service the way we felt we could really honor our commitment to our vision. And really the primary purpose was to approximate that roommate relationship. And so what I feel we have built is a unique service. It's unlike any service in any other state that I'm aware of, and any other service that's available in our waivers program. And so I'm happy to talk to you about that today. Okay, so as I mentioned, our vision for the service was to replicate a roommate relationships. But in order for that to authentically occur, we had to make sure that the individual and his or her roommate would be equal in terms of the power structure in the relationship, and that they would both benefit from the arrangement. So if you are familiar with waiver services, this is very different, right? There's usually someone in services and someone providing support for them, and they're either working for them or they're working for a provider agency. So with this dynamic, it's very typical that the roommate is usually a paid DSP, and that is not something that we wanted for this service. So let's talk about what the service is and what it's not. So to use shared living, someone has to be enrolled in one of the 3 DD waivers that's funded by Medicaid. So we have the building independence, the family and individual supports waiver, and the community living waiver, and be authorized to receive the shared living waiver service. Okay. With shared living, the individual lives with a roommate in an apartment. It could be a home. And ideally, it's chosen together through some sort of a person-centered process. And the roommate is providing some limited supports that they agree upon in advance. And in exchange, the roommate receives rent, food, and utilities paid for by Medicaid. So even though the service was designed to be flexible, it is a waiver service. So we have some rules that we have to apply. So both the individual and the roommate have to be 18 or older. They're choosing to live together. In terms of the relationship that's acceptable, can be a sister, a brother, cousin, friend, close relatives, but not the mother, father, any type of parental relationship, legal or biological, no grandparents, no spouses or guardian. So no one that's legally responsible for the person. It is between one roommate and one person with a disability. It is flexible enough to assist with affordability. So it is designed to work with and without rental assistance, so our housing vouchers that were already referred to earlier. It's not a standalone service. So that means that the individual receiving the service must have at least one other waiver service in addition to shared living, and we'll talk more about that in a few slides. The individual must be the primary leaseholder. Okay, that means they are listed as the tenant on the lease. There can be joint leasees, so two siblings who are living together and they choose to both be tenants. But in most cases, the roommate is going to be either an occupant or unnamed on the lease. Now, something that's very important to note about this service is the roommate truly is a roommate. They're not a caregiver. They're not a paid attendant. They are there to be an extra set of eyes and ears in the household. So we would expect that they'd look out for the individual the same way any roommate would, just like when you're in college, you're going out and you're expected back at a certain time. And if you're not there, there's someone who could maybe alert someone that something is not happening the way it should. Okay. But the difference is, even though this is a waiver service, the roommate is not responsible for the individual. They're not an employee of them. They are not a provider. They're not responsible for their medical, habilitative care, health, welfare, or development. They're not there to make sure they learn skills. They're not there to do anything but provide this service that I'll talk about in the next slide. So the roommate, again, this is a reciprocal, hopefully equitable relationship. So the roommate might have a job outside of the arrangement. They cannot work for the individual. Okay, so if they're providing services for them as a DSP in another environment, then they cannot be a roommate. There's some training for the roommate that we require. So CPR, first aid, emergency preparedness, some conflict management. There's no certifications required because they're not responsible for the person. So in an emergency, we will want them to know maybe CPR, first aid, those kind of things, but we don't require them to be certified every year like we might for a DSP, for example. And then there might be other training that the individual might want the roommate to have, something maybe specific to their individual disability. Every waiver service has to do a background check, so that is still required. And another important thing I want to think about for if there are any individuals who are listening on the call is that this service can be accessed via the Building Independence Waiver. So if you are receiving services through the Building Independence Waiver, which I think you have to demonstrate you're moving to independent living in some manner, you could access this service a little bit quickly, and then there would be no waiting list. All right. Okay, so what is shared living? So primarily, the purpose of the service is to provide fellowship and companionship supports. And so because of that, each roommate match is unique. The exact supports really are going to depend on the individual and his or her unique match. But the supports can include, for example, conversation, games, crafts, accompanying their person on places they want to go, walks, running errands, appointments, all those kinds of things. The roommate is there to provide enhanced feelings of security. So they're a social and emotional support inside or outside the home. And then they also provide limited supports with activities of daily living, those ADLs and IADL. And so when we say limited supports, we mean that no more than 20% of the total time that they spend together with the companionship or fellowship time can be spent doing personal care tasks. So meal prep, like housework, those kinds of things. All right. So all three, as I mentioned, of our waivers support the shared living service. However, service compatibility, so the services that you might use to pair with shared living really depend on which waiver you're enrolled in and your individual support needs. And so because shared living is really considered to be an independent residential model, most congregate residential services are not compatible with shared living. So for example, you wouldn't be able to get shared living with a group home or those kinds of things. So also for this service, we have to have a backup. And in this particular instance, the backup must be family, friends, or someone else who can help out when the roommate is absent from the home. And in a case-by-case situation, an individual can be temporarily authorized for additional waiver services above what they're usually receiving, but that is on a case-by-case basis. And in the case of the roommate's absence. There can be transition funds that are accessed to help with costs related to moving in. And so there's some guidance about transition funds and some of the information on our waiver services. Okay, so these are generally the services that are compatible with shared living. So that means both services can work together. And so if you're receiving shared living service, you may also receive one of these services. The ones that are sort of bolded are some of the more common compatible services. I'm not going to read them to you, but I'll pause just a little bit so you can kind of take a look at some of the services that you could possibly pair with shared living. Okay. All right. So I want to talk a little bit about the supports agreement. And this is really important because this is the foundation of the service. So the supports agreement is really developed from open and honest discussions between the individual and the roommate about the things that the roommate will do for and with the individual. And so this is where what's important to an individual and to the roommate gets to be discussed. So the things that you like jointly that you want to do together and those deal breakers. Okay. So if the individual does not want people wearing shoes in their house, that is something that could be discussed and possibly included in the supports agreement. Or maybe the roommate is allergic to certain air fresheners, but the individual really likes them. So they would have these conversations about, okay, like, what can we do to keep the house smelling fresh without using air fresheners? So all these kinds of things are discussed in advance and agreed upon. And so the supports agreement, again, covers what's important to both of them to be happy together. It includes things such as vacation time for the individual and roommate. It goes over the support that the individual wants the roommate to provide and how they would provide it. It provides sort of an open schedule for when the roommate's going to provide supports and when they're just, hanging out with their companionship time. It identifies who the individual wants to support them when the roommate is gone overnight. So that backup plan is included. Okay. And then how their other needs will be met outside of shared living, and even how the agreement would end. And the supports agreement can end at any time. So if the two decide that they want to add something to the supports agreement or remove something, that can be done at any time. Okay. So in case there are some interested individuals and even some providers on the call, I wanted to talk a little bit about reimbursement, okay? So the reimbursement under this service is based on an amount that's attributable to the roommate, okay? So their room and board, and then there's an amount that goes to the provider for oversight of the service. So for the roommate's portion, reimbursement is limited to up to 50% of the monthly rent and utilities, okay, up to a maximum. And that maximum is based on where the individual lives. So most of the services under the waiver are built out that way, with 2 localities, rest of state, Northern Virginia, and this service is the same. So for rest of state, it's 912. For Northern Virginia, it's 1100. And this is the maximum, okay? So depending on what your rate is, you can receive up to 50% to a maximum of these amounts, okay? And so I'm going to skip down where it says expense and look at the internet service. So there, after we look at the room and the utilities, and there's $100 utility, I forgot to mention that can be added on to the rental reimbursement if they're not included in the lease. But then we start adding on internet, which is $25 a month, flat fee, and then food, $308.40, which is also another flat fee. And then we add the provider reimbursement. And again, you see there are 2 rates, one for rest of state and one for Northern Virginia. And added together, that is the total amount that the provider would bill for the service. All right. Make sure there's nothing I'm forgetting. The other important thing is the provider gets paid for overseeing the service in terms of the billing. They receive a check for the total amount, and then they pass through that information, the amount that goes to the roommate. So they're a pass-through agency as well. Okay. All right, so now we have a pretty much good understanding about, sort of the regulatory requirements. I want to take a few minutes just to go through the roles of the people who are trying to help you get the service and the individuals who might be interested in receiving the service. So support coordinator, very important. They are the front door, and they are the front door for every service. So they connect you to the service and to a provider agency, and they really are there to make sure that the person is well prepared to undertake the service. So if this is something that you thought you should be interested in, you would go to your support coordinator, okay? The provider is there to help the individual find a roommate, to complete the screening and training. We talked about background checks, that all that is part of what the provider's responsibility would be. They make sure all the background paperwork is completed, and they oversee the service. They also oversee completion of the supports agreement. As I mentioned, they handle the billing, and then they send the reimbursement to the individual on behalf of the roommate, however it is that they have decided that they will split that task, okay? And so for the individual and family, really, I've included them together because it's important that the individual and the family members are both well prepared for the service, that they understand the service well enough to know if it's the best choice for the person, because it is very unique and it is not necessarily for every person or every match. Okay, so there are 2 paths to shared living, okay? In the first path, the individual is either already accessing rental assistance. And so if they're using rental assistance to access shared living, that means they've already had their roommate chosen, because that's part of the process, and they have a signed lease. So it's a little bit easier for them to access the service. However, and there's another thing that I forgot to mention in that other slide with the reimbursement. With the rental assistance, you will only be able for the roommate to access room and board, because the housing voucher or the whatever rental assistance program they'll be accessing is already covering the rent and the utilities, okay? But on path B, if the individual is not receiving rental assistance, it's going to be a little bit longer to access the service, okay? Because we have to make sure they've demonstrated housing readiness, okay? And in most cases, they have not yet located a roommate or housing, okay? So I'm gonna try to go really quickly through these steps because it's a lot of information. I'm just gonna try to simplify it as much as I can. So the steps. So if the person is using a rental subsidy, Then they're working with the support coordinator. In most cases, they're probably working with the DBHDS housing specialist. So those are staff that help facilitate the referrals for housing vouchers and through the SRAP program. They are going to work them through the process of securing rental assistance and obtaining that housing. We do have two other waiver services that can be used to help with this process, including the community housing guide and the peer mentor supports. And so through those services, you actually could have somebody help you tour homes and talk to others about their experience in independent housing and use them as a guide to, think about whether or not the service is right for them and how they might structure it for themselves. Okay, so the housing coordinator is reviewing the referral and all the other information submitted for the application. And one of the important things that they will help is to agree on the status of the roommate according to the Public Housing Association guidance. So I mentioned before, the individual has to be listed as the tenant. But in some cases, there may be people who want the individual, the roommate, to be a tenant as well. And that is allowable if they both agree. However, we need to make sure that people understand this is a real lease with real consequences. So if you have two people who are listed as tenants on the lease, then they're both legally obligated within that lease to pay rent. And so it would be a different situation in terms of if they should choose to terminate the lease or something else like that. Okay. Once the individual has demonstrated housing readiness, okay, and housing readiness is anything that you need to do to make sure that you're ready to live independently. Okay, so making sure your credit is good, making sure you have a sound budget, knowing how much you have to spend, knowing where you want to live, knowing, what characteristics you want in a roommate, all those kinds of things. When you can move in, those are considered housing readiness. And most importantly, like how you will be supported in the unit once you do move. So what services would you actually be accessing and other supports would you need? Okay. And so once that is done through the ISP process, then they're connected to a provider through the support coordinator. Okay. And the provider can be enlisted to help the person find a roommate. So one of the important things is to know is that the provider and the support coordinator, although they have different roles, they're expected to work very closely together to make sure to level set expectations regarding the service and its limitations and allowances. Okay. So we talked about the fact that the provider is going to help them get together and fill out the supports agreement, the backup plan. Once they have their lease signed and the roommate identified, then they begin the process of authorizing the service. Okay. So some of the things that will be asked is a copy of the signed lease, service documentation from the provider. So we mentioned that there's training required. So they have to show the proof of the roommate training, the proof of the background check, copy of the supports agreement, and a few other things that are very specific to service authorization. And so all that gets forwarded to the service authorization consultant. They verify the information was submitted. They calculate the reimbursement. The service authorization consultant calculates the reimbursement according to the rules for the service. And then they are responsible for finalizing that authorization in our waiver management system. So service monitoring, okay, the provider is submitting those monthly claims for reimbursement based on the amount that's determined through service authorization. And so in order to make sure that the provider is monitoring the service, we are making sure that there is provision of supports. And in our case, it's the fellowship, companionship supports, and the limited ADLs, IADLs. And those are going to be included in a checklist that is signed weekly by the individual. The checklist sort of summarizes all of the things in the supports agreement. And as they do them, they're checked off, they're turned into the provider, and then the provider in turn sends them to the support coordinator. Both the provider and the support coordinator, this is their way of making sure that everything in that apartment or home is going along okay. So that's how they know, like, okay, did this not happen this day? Is there something that we need to perhaps change within the service, add more of, subtract things, those kinds of things. And the results of that checklist should be used as part of the quarterly review, which is the face-to-face visit. If you're in a service, support coordinators coming to see you face-to-face in your apartment to see how everything looks, to interact with both the individual and the roommate in that natural environment to make sure everything's okay, and to see if there's anything that needs to be changed in that particular service. And these are the things that are required through a regulation for the provider to maintain to be compliant with the rules for the waiver. Okay. So one of the things I like to do, we've gone through all of those details, and one of the things I like to do is to talk about what this service looks like on a day-to-day basis. So Callie and Lupe are not real people. They're a combination of people who have used the service in the past. So I've put together sort of a contrived story of what shared living could look like when it's operationalized. Okay. So Callie and Lupe are cousins, and they live together in a 2-bedroom apartment. They're around the same age. They enjoy spending time together. Callie has a job working part-time at Kroger, and Callie has DD. Lupe is in her second year of college, and they have agreed to live together until Lupe graduates. Callie is receiving rental assistance. Rental assistance covers the rent and utilities for the apartment. So Lupe, as the roommate, gets the payment for food and internet. Now, Callie is fairly independent. She can do a lot of things for herself, but her main support need is that someone be at home with her every night. Okay. And so they agree that Lupe will spend the night at home every night. And if she cannot, then there must be a backup available. All right. Callie works mornings, Lupe attends mid-morning classes, and at night, some of the supports that are outlined in the supports agreement. And then on the checklist, Callie picks out the clothes at night. And Lupe helps Callie pick out her clothes at night, reminds her to take her medication in the morning, companionship and fellowship. They eat dinner together in the evening. They switch out who cooks. When it's Callie's turn, Lupe will help her. So that could be where some of the other ADLs kick in. Sundays is their day to spend together doing things they both enjoy. Doesn't have to be the same thing every Sunday, but they could take turns doing different things, going to the movies, bowling, and eating out. But that's the day that they spend together. And there's usually a time increment that they decide that they want to spend together. For daily tasks, they create a list of groceries, they share chores, and Lupe will help Callie when needed. Okay, so again, each day they've got the checklist, might be on the refrigerator, and Lupe is checking off the things that they're doing together from the supports agreement, and then Callie signs it each week. Okay, the provider, as I mentioned, collects the checklists. They're sending them off to the SC. The SC should be reviewing them. And that should be the basis of the conversations that she has with the pair when she's visiting them during the face-to-face meeting, just to make sure things are going okay. All right. So tips for success with this particular service from the perspective of each of the 3 roles that I mentioned. So from the support coordinator role, I really think that it is helpful to ensure that all of the benefits of shared living are known and compared to other residential services. So we really want to make sure that we understand what the service is and what it is not. So if you are looking for a service where there is a person who is responsible for the person's health, safety, and welfare, this is not that service. Okay. There could be another person who is, used as a DSP to come into the home and provide that level of oversight and support, but that is something that has to be considered. We want to make sure the support coordinator is there to make sure that the person has achieved housing readiness. So all the things that I mentioned, they've gone through, the ISP, the plan, and made sure that all of those goals are met and they're ready for this new role. And again, as I mentioned, the Building Independence waiver is, I'm sorry about that typo, but it is a great way to be able to access the service with limited wait time. Okay. The provider, screening roommates closely, even if they know each other very well, because it's one thing to have a friend, but sometimes friends, don't always do well when they live together. So the provider making sure that they have those honest conversations about the things that tick them off, and how they're going to deal with conflict. Conflict management is one of those things that there's required training for both, but that screening and those conversations are really important. Reviewing lease allowances and restrictions with both the individual and the roommate. Okay, so landlords have their own rules. Okay, so if you have an individual and they are listed as a tenant and the roommate is an occupant and they're not named, that roommate may not be able to use the pool. They may not be able to use some of the amenities that may be available in the unit, in the property as a whole. So it's important that they both understand this so that once they get into this relationship and this arrangement, that they're both pretty much knowing what to expect. And again, I can't emphasize how important it is for the provider and the support coordinator to work together. The key to success for the service is they both are working together to know what is working well for the individual and roommate. And that is another way that this is different than other services because they are very closely connected and with this particular service. It's not hands-on, but it is there's very close oversight. Okay. And so for families.
Deanna, I'm so sorry to interrupt you, but
Are
we
we out
are
of time?
at time.
Okay,
And we
yeah, I
have a
figured that
couple
would
of
happen.
questions, and I'm
I
so
figured that would
sorry to
happen.
cut you off.
This is fine. This is the last slide. Yeah.
But this is interesting. I mean, this could be a whole hour in itself. So thank
Yes, it
you so
usually
much.
is. I tried to condense it as much as I could.
Oh, yeah, this has
Yeah,
been really informative. But I do want to ask you the couple questions that we have in the chat really quick, if that's okay.
absolutely.
So one of the last questions that came up, and I'll just work my way up the chat, is that it sounds great. What are the biggest issues or challenges that people are experiencing in practice? Are there constraints in the system? For example, the housing crisis is one major system constraint. What are some constraints or challenges that you're seeing in practice?
So we were able to resolve one of the biggest constraints because when we initially rolled out this service, the reimbursement was really low, really, really low, like really low. And so what we were able to do is tie reimbursement to the FMR, so the fair market rent. So every time that goes up, the rate for shared living goes up. So it's a more realistic rate for people to be able, I mean, it's not, you're not going to be living in the lap of luxury, but it is definitely helped spur interest in the service for both the provider and the individual. But the practical challenge is still individuals finding a roommate. That is the biggest area. And we're working with the Arc of Virginia. We've contracted with them to have a consultant who is helping to create sort of like a program to market the service to people who would be good roommates. So the challenge would be to have a ready source of roommates, but also make sure that it's done in a person-centered way. We don't want to just put people together and hope it works. Yeah, so that's probably the biggest challenge that we're experiencing right now. And overcoming the fear, because the service works so differently than most waiver services where people are used to this person is there as a care person, a protector, those kinds of things. This is intended to be independent living, for sure. So there's sometimes a little bit of fear from families, providers about how this will work in real life.
It sounds like such a great program. It could really be a win-win, especially in like our college communities. Those people that have some natural supports that aren't living with them, that could be a really wonderful situation. Your example was great. Um, Thank you. Someone did ask if we were going to share the slides, so we do plan to share the slides. And then our APSI member just asked if this is something that you often do with supported decision-making agreements, individuals with those supported decision-making agreements. Do you see a lot of those with individuals that access this service?
They're not inherently connected, but they certainly could use supported decision making. That's my area as well. We have a staff person who that's her job to kind of like help people develop those agreements. But if you want to sort of relate the supports agreement to the supported decision making agreement, that is something that could be done. We would probably want to look at that a little bit more closely to make sure that we're not obligating the roommate to something that they really shouldn't be obligated to do in their role. But yeah, that could definitely we could pull things out and put it in there. Absolutely.
And Sarah actually was our first speaker with the supported decision-making program, so that really sparked a lot of interest too. And then Jacqueline Turner noted that another challenge, you were speaking of challenges, may also be that some communities have used up their SRAP vouchers and their local housing waiting list is frozen. So that could be a
Yes.
challenge.
But what I will say is it helps with affordability, but if you have the right arrangement, then you could still possibly use the service. And so, like, I'll give an example, like, of a mom that had a property. She rented it back to her son, and so we've developed the regulations so that a wide variety of different arrangements can be accommodated in the service. So you don't have to use rental assistance. If you need rental assistance, and you have a voucher, we can accommodate that. But with rental assistance, we're not going to get rent and utilities. You're going to get food and you're going to get internet. So you get about $334, which is not bad, right? Because you're already still getting an apartment to live in and utilities through the rental program. So it doesn't have to be a barrier. It depends on the situation that is there with that pair.
Great. Thank you. Those are all the questions that are in the chat. Your time has just been really invaluable, Deanna and Kelly. Thank you so much for joining us. And everyone, this session is being recorded and it will be available. We'll be sending it out via email. And then hopefully we'll be able to send out the slides too.
Thank you for the invitation. Appreciate it.
Thank you.